Hi, Dr. B here of AskTheDentist.com. So today we're going to talk about one of my favorite subjects. I pretty much screen every single patient for this, and I have recommended this to many other healthcare professionals, and they all come back and they're amazed. They're amazed that no one has mentioned it to them, that they've never heard of it, and they're amazed at what the effect is once they do this. So let's back up a little bit. Mouth breathing. Mouth breathing, you'd think breathing through your mouth is normal. It is not. We are designed and destined and have evolved to breathing through our nose. Breathing through your nose is a much healthier thing to do. So what's the big deal about mouth breathing? Well, if you mouth breathe as a child, it causes developmental issues, airway issues. The downward forward growth of your face is not as good and as well developed. Your occlusion, the way your bite, the way your teeth come together is affected. Your propensity to gum disease, cavities, poor breath, bad breath in the morning, all those are increased by breathing through your mouth. If you breathe through your nose, that's not going to happen. So how do you know if you're a nose breather or a mouth breather? And this is something you should find out. I recommend that everyone try this, and that is mouth taping. And you heard me right, taping your mouth shut at night. So I recommend using Micropore, 3M Micropore. It's inexpensive. You can buy it on Amazon. You can tape in this direction, or you can tape over your mouth. The tape is pliable enough and not that sticky where if you had to open in the middle of the night, you can overcome the adhesiveness of the tape. But if you wake up with the tape on in the morning, then that's the first step. You've done a kind of a differential diagnosis. You've discovered that you can actually breathe through your nose. If the tape comes off in the middle of the night, and that happens over the next few nights, then you should go see an ENT and find out how you can become a nose breather and get rid of the mouth breathing. And of course, if you can wake up with the tape and it's still on, then you know that you're breathing through your nose. You're going to start feeling better. Breathing through your nose at night actually has an effect on the brain. There's an oxygen load on the prefrontal cortex if you're a mouth breather. And again, remember the prefrontal cortex is where ADHD is associated. So you know, that's one of the things that mouth breathing has an effect on, is your brain in a negative sort of way. So again, mouth breathing, find out if you're a mouth breather. Mouth breathing is not a good thing for a variety of reasons, and not just for your mouth, but for your overall health and your brain. And if you can make it through the night with tape on, then you know you're doing well. And I would keep taping because it does make you feel better in the morning. It also makes you snore less. The way the air goes through the airway changes. So again, mouth tape. Please tell your sleep partner that you're taping before they come and see that. That may upset them a little bit and worry them, and you should both try it. Everyone should try mouth taping at least once and find out if they can breathe through their nose at night clearly and properly. And I would continue mouth taping. I know I mouth tape every night. I know that the times that I don't mouth tape, I don't feel as good in the morning. And that's even wearing a oral appliance. Some people, depending on what kind of mask they wear with a CPAP, can also mouth tape. So I recommend mouth taping, and I think everyone should try that. So if you need more information, we have a post on AskTheDentist.com about it. I would read that, and if you have any questions or comments, please leave them below. And again, try mouth taping. It could make a huge difference for you. Thanks for listening. We'll see you in the next video.